Welcome to anatomy series. Let us begin with nomenclature. First of all, let us try to understand what is anatomy or human anatomy. Human anatomy is a science which deals with the structure of human body. Anatomy in Greek means cutting up. It is the foundation of medicine. Subdivisions are, there is cadaveric anatomy that we learn in the dissection hall, then living anatomy, that is which we learn on a subject, embryology, developmental aspect, histology where we study the microanatomy, there is surface anatomy where you can draw on a mummified body, radiographic anatomy where we learn on the radiographs, there is comparative anatomy where we compare with other animals. Applied anatomy is the clinical aspect of the whatever we have learned, that is a clinical aspect of anatomy. Most of the anatomical terms are in Greek and Latin. Let us remember that. Okay. The terms used are very important is the anatomical position, which is asked in your viva. What is an anatomical position? Anatomical position is a position in which the person is standing straight. The arms are at the sides, palm facing forwards, fingers extended. The feet are facing forward and the head and the eye as well. And the eyes look at infinity, some books mention like this. But this is the anatomical position. So, whatever we are going to learn will deal with this anatomical position always. Let us learn the terms as the lecture itself is nomenclature. Supine position is lying on the back and having the face upwards. Prone position is where you are lying down with facing downwards, lying on your face facing downwards. Then there are planes of the body. There are three planes: median plane, sagittal, coronal, or median or sagittal, coronal, and the transverse. Median plane means it is running through the body in the midline, that is from the head to the feet, and thus it divides the body into two parts, that is right and left. Any plane which is parallel to this median plane or parallel to this sagittal plane is known as parasagittal, जो ये plane के side से जाएगा, that is known as parasagittal. Coronal plane means corona is a crown, so consider keeping a crown on your head and the plane which runs through the body from the head to the feet and divides the body into front half and back half. That is a coronal plane. Transverse plane, any plane that divides the body into upper and the lower section. So, it is running transversely, that is a transverse plane. So, these planes you should remember because whenever we are studying, the diagrams given are in a sagittal plane, parasagittal, coronal or transverse. So, you should know the planes. The terms which are used are, there is lateral and medial. Lateral means away from the median plane and medial is towards the median plane. Superior, inferior, also known as cranial or caudal. Superior means cranial towards the head, inferior is caudal, that is towards the lower end. Cranial caudal is mostly used during embryology, when we study embryology. Anterior and posterior, anterior which is in front and posterior which is behind. Similarly, here ventral and dorsal terms are used mostly in embryology. Then superficial and deep. Superficial is the structure which is close to the skin and deep is very much below or deep to the skin. So, this is to show you how this is anterior, posterior, lateral and medial. In the limbs, we use the terms distal and proximal. So, distal means away and proximal means towards the body, okay, towards the trunk. So, this if you see the toe or the foot, this is distal and here hip joint will be proximal. Let us learn certain terms, the movement terms, flexion and extension. Flexion is where we reduce the angle between the bones. Okay, so if I see, if I am folding my elbow, then I am doing it flexion from the starting point to this point, folding and bringing two surfaces close to each other is known as flexion. Extension is opposite, where I am increasing in the angle. Okay, so this the bringing the hand back here is known as extension. Next term, adduction and abduction. Adduction is towards the central axis. Like if my hand is away and I am bringing it to close to my thigh, I am adducting it, bringing it close. Of course, this is not the example in shoulder joint. Adduction is not this, but I am just trying to explain you that bringing it towards the central axis, whereas abduction is bringing it away from taking it away from the central axis. Adding it, so bring it close. Try to remember it in this way. Supination and pronation. Supination is when you rotate the hand so that the palm faces anteriorly. So this is supination. And pronation is where you rotate and move the palm posteriorly. And this will be pronation. And supination, as we know, in anatomical position, we already said that the hand is in supine position. Okay, so that is the supine position or supination. Whereas supine and prone is, supining is it is in lying down position, and supination and pronation is the rotation of the hand. Okay, rotation. Rotation, there is medial rotation and lateral rotation. Rotation means rotation of the entire limb. Laterally, that is away from the body, or rotation towards the midline of the body, it can be medial rotation. Circumduction is, it is a special case of movement in which there is adduction, flexion, extension and then abduction, and it creates a circular movement. So this is circumduction. So we saw rotation, that is medial rotation, bringing the arm towards the body. Lateral rotation is rotating it laterally, that is outwards. Circumduction is completely using all the movements. Circumduction is possible with the shoulder joint. Then protrusion. Protrusion is when, if you see this, or that is protraction of the mandible, example over here, bringing it forwards or anterior movement. Retraction or retrusion, bringing the mandible back, opposite of protraction. Elevation, this is again the example shown in relation to the mandible. So elevation is superior movement. In shoulders, if you shrug your shoulders, that is known as elevation, and depression is opposite of elevation, that is inferior movement. Then special cases, that is foot and hand. For example, if you flex or if you bring your toes towards your superiorly, trying to decrease the angle here in between, like flexion. In flexion we have said we decrease the angle, but this is known as dorsiflexion because the upper part of the leg, this foot, you call it as dorsum. So this is dorsiflexion. Similarly, the lower part of sole is known as plantar, and so when you flex here, it is known as plantar flexion. We do not call this as extension. It is dorsiflexion and plantar flexion. These are the special cases. Similarly, in your palm also you do that. Palmar surface, which corresponds to the sole of your leg. So plantar, and dorsum is both. Dorsum is the back of the hand as well as dorsum is the dorsum of the foot. Okay. Yes. Then it is the palmar and the plantar surface, though we say the sole and the palm, sometimes orthopedic surgeons, they use the term volar for this. So do not get confused in case somebody uses the term volar. Okay. The foot is also capable of another movement, that is known as the eversion and inversion. Eversion is movement of the sole of the foot away from the median plane, whereas inversion is movement of the soul towards the median plane. ये दिख रहा है यहाँ पे, ये medially जा रहा है, inversion है, ये soul बाहर की तरफ जा रहा है तो eversion. So here are few examples. The thumb lies lateral to the index fingers, means you understand how the terms we are using. The vertebrae of the spine are posterior to the abdominal muscles. The wrist is distal to the elbow, and the shoulder blade, that is the scapula, lies posterolateral to the spine, means posteriorly bhi hai or laterally bhi hai, तो posterolateral to the spine. These are the terminology what you will be using ahead in entire anatomy. So this forms the basic lecture. Okay. Now if you are describing any bone in osteology, there are certain terminologies, like there is an elevation, if at all, then it is known as ridge, crest or spine. If there is a depression on the bone, it will be known as pit, fovea, fossa. Openings are known as canal, hiatus or foramen. Cavities are known as sinus and antrum, and if there is a smooth area, articular area, it is known as facet and condyle. Terminology in applied anatomy. Itis is inflammation. Appendicitis, inflammation of the appendix. Okay. Ectomy is removal. Appendicectomy, क्या ऑपरेशन किया? एपेंडिसेक्टमी. एपेंडिसेक्टमी तो अपेंडिक्स को निकाला, रिमूवल. ओटोमी इज टू ओपन एंड क्लोज अ हॉलो ऑर्गन. मिरिंगोटोमी, मिरिंग ये अपना sorry tympanic membrane. Tympanic membrane, they usually open and then they work over here and again they close back, तो ओटोमी उसको भी बोल सकते हैं. And oma is a tumor. Carcinoma is a tumor. So I think now you all are set to use these terms. So let us study anatomy in depth now. Thank you.